Wow, that was amazing. I've seen Helen, I've seen you present in the past on what you guys are doing, and just super, super exciting. I mean, I don't know about you guys, but my response to seeing that is, oh my gosh, I want that, right? And so I just feel super honored to be here on this stage, and you know, we have Helen, we have Sunita, we have this amazing team, Laurie and Tom, and like this is the future of not only functional medicine, this is the future of medicine, right? So we're seeing some information at this conference over the last few days, and especially this morning, I think, of really like how this is going to push us into the future of care. And so I want to go through sort of what I'm doing here, and I'm kind of the clinical bridge. I run the California Center for Functional Medicine. I've been doing this functional medicine piece for 25 years and running this clinic for 10, and founded it in 2014. So I'm in the trenches. I'm doing this day in and day out, and I think of myself as a tech optimist and very tech forward, very AI excited, very all in on it, but also cautious. There's definitely some caveats and things we have to think about how it's going to play out. But what we're doing right now, we're seeing this incredible pace of development and of tools coming, tools changing, and so daily, weekly, monthly, things are iterating, and so it can be a little intimidating, I think, to stay on top of it. But my encouragement to everybody would be just like, it's like we're surfing a wave. We're at the start of this wave, and just get on the wave. Just get on the wave and ride it, and try out what feels comfortable to you, a little bit at a time. Grow, experience, questions will come, you'll start to understand how it works, you'll move into other platforms, etc. So don't be shy, but do get on the wave, because this is not going anywhere. This is the future, right? And so we all need to learn how to do this and how to best bring it into our practices and into our lives in a safe and effective way. Rapid evolution. So I'm going to just try to give you a current snapshot of what we're doing, and I think, again, Lexi did an incredible job of that, as did Michelle Leary and Mike Ash, and so, but I'm going to expand on this from my perspective. So, there are a ton of platforms out there already, and it can be very difficult to track what's what. But, for example, this is just a visual snapshot. We spent the last couple months at a longevity conference, pop-up conference in Berkeley, talking about longevity, talking about health span, talking about AI, and there's so much excitement in the life sciences, in the medical field, talking about scribes, talking about clinical decision support, all these pieces. This is a really cool platform called Elion, if anyone's curious about this space. It's basically just like a database where you can go and you can look up all of these companies. And so you can click through, this column here, AI products. This is basically like a lot of different health IT, so not just AI, but AI products, fascinating to me. I submitted my slides to IFM, looked back yesterday on my email. I submitted them on April 8th. So between April 8th and now, there's been a significant change. I looked at this platform yesterday. There's been a significant change in the number of companies out there. So just in this AI clinical assistant category, there's now, I think, 212 to 215 companies. In the scribe section, there was 79 in April, there's now 84, right? So, it's just, the pace of change is immense, and this is a very hot area, a very sexy area, if you will, not just to medicine, to providers, but also to VCs, to funding. This is a fast-moving thing. So, how do we do it? How do I do it? I have my favorite tools. As you get experience with this, you will also. I would say the top three that I'm using every single day are ChatGPT and Consensus.app. Consensus.app, definitely take a look at that, as well as Open Evidence. So frequently I'll have all these things open on my desktop, and I'll be iterating with them during visits or before and after visits, or just asking questions as they come up. So getting real-time answers, getting answers to clinical questions, doing visit preparation, going through data, parsing data, trending data, and then providing research-backed responses. And so, for example, I'll have those three platforms up, and I think it's interesting, right? So Helen, when you're doing your demo, there's like a little bit of lag there, right? And also with Vibrance, sometimes you put a question in, or with ChatGPT or any of these platforms, like a little bit of lag. So I'll have these three things up. I'll go to ChatGPT, for example, I'll put in a question, and then I will copy the question, I'll hit go on ChatGPT, I'll switch over to Consensus, paste it in, go, switch over to Open Evidence, paste it in, go back to ChatGPT, and now the answer is there for me, and I just kind of quickly review them, and then kind of parse that data, and all of a sudden, I am augmented, right? I have now leveraged my brain, but I've also kind of pulled in this other information in real time, And we're totally virtual. I'll frequently do a Zoom screen share with the patient at that point and show them what I'm finding, right? And you might think, the patient might be concerned, or that maybe not getting the data from you as a provider, but no, they actually love it, right? It shows them that you want to learn, that you are humble, that you are also curious, and that you have these really cool tools that you can use to bring to life questions or bring data or bring more discussion, right? So we use that as a jumping off point. Plus, I will at that point show them if there's discrepancies between what I'm finding on ChatGPT versus these medical grade systems, consensus and open evidence. Open evidence is built by Mayo Clinic and they have access to all of JAMA now. Consensus is basically literature search. So both like you can click through on the articles to the actual study and look at it that in whatever depth you want. Consensus, one aspect of that that's really cool is that if you ask a yes/no question, it will give you a consensus meter. And so, for example, I was preparing for a talk for this longevity conference, and I was on autoimmunity, functional medicine, health span longevity. So I was looking at, okay, microplastics, are they connected to autoimmune? Just put that question, it's super simple, and you get like a little graph at the top. It says, based on the available research, yes, 63%, maybe 37%, and then there's no. Which is 0, right? So yes and maybe is 100% are microplastics connected to autoimmune, right? So really cool, really compelling visual presentation of the information. So yeah, lots of richness there. Deeper research workflows. So many people have seen these deep research models, right? So you go to these chatbots and you have the sort of regular back and forth model, quick responses, gets you what you need, but it's fairly simple, maybe a few sentences up to a couple of paragraphs. But then there's these deep research models, right? So you go to ChatGPT, for example, you click on the little icon that looks like a telescope looking out into space, and then you put in your query, and it'll come back at you with some clarifying questions. You say, well, what do you want about this, and how much depth do you want here, and how do you want it to be presented, more formal or lighter, et cetera, et cetera. You answer those questions, you hit go, and then it works on it. Takes anywhere from 5 to 15 minutes sometimes, and the output that it generates can be 25, 30 pages, right, with links out. So really, really helpful. But what I found is that if you prep that, you actually get a much better output. So do what I call surface research, right? Begin with gathering the basic information. Do this multiple chatbot, maneuver. Take those shorter outputs, put them on a Google Doc, just keep pasting them in. As you read something, you come up with a side question, search that, paste that in, and then take that whole Google Doc and on your LLM, hit the little plus button, upload that file, and now run the deep research. So now you've sort of prepped the model and you've given it your, your first pass on it. And then when it runs this deep research query, it actually presents a much more in-depth output for you. And it's similar a little bit to what Mike Ash was talking about with functional mind, was you really get in there and you prompt these things and you can push them to create a really impressive output. Another thing that we're doing, sleep, super important. Sachin Patel talked about breathing. We think about nighttime breathing, we think about disordered breathing, right? So what's happening at night? Are they having desaturations? Are they having elevated heart rate, cortisol surges, etc.? We use the sleep image ring. Occasionally we'll use the watch pat, and I'll send it out to their house, and I'll have them collect 5 days of data on this thing. I'll have them just wear it for the first 2 nights just to get used to it, right? It's that sort of first night effect of what is this device, and like, is it recording, and you're kind of fiddling with it so you don't get normal sleep. And then on nights 3, 4, and 5, I'll have them do mouth taping in 3 different formations. So first just vertically so you can kind of get used to it, and then the 4th night in an X, and the 5th night all the way across. And then you can look at that data and see trends, and I'll show that to you in a sec. But one thing I want to talk about first is that you can build your own GPTs. It sounds really fancy, it sounds complicated. Do I need IT involved? No, it's super simple. You go into ChatGPT, you go to the settings, you say build my own GPT, and you can give it parameters that you want it to pay attention to, and that's just saved there, right? Sort of like a set of orders, or a chart part, or a text expander, whatever you want to think of these technologies. So I went in there, I built my own GPT, I said, I'm going to upload these nights of sleep data, I want you to create a table, I want you to trend it across the nights, I want you to show a column of all the values, and I want you to also do it in relationship to this set of normal values that I'm going to give you. And so only use these. Don't pay attention to the what's on the page itself, right? And so now I hit go, and this thing all I do is go back to that pre-saved set of directions, upload my CSVs, hit go, and I get this really cool table, right? So here's all the parameters. Here's the trend over the different nights. They're flagged. It tells me about trends. etc. And instead of having to then go between each report, eyeballing, switching back and forth, like, is that different? Is this different? What's the trend here? I get this really nice output that I can copy and paste, put in the chart, discuss with the patient, etc. And we can see trends over time in relationship to just using the device and also the mouse taping, right? So yeah, it's a little clunky. It's not very pretty. I think that what Fountain Life and what the future of this is looking like will be way better and will be sort of next level. But you as an individual clinician can actually access a lot of this already. And so you just have to kind of know some simple tweaks and how to get in there. What about patients? How many people have experienced a patient bringing, it used to be like, oh, I Google this and now here's, what do you think? But what about AI? Like, how many people have seen patients presenting AI-generated data? So I'm seeing it more too, right? And it's very, very interesting. I have two patients in particular, one who literally put everything he has in his medical record from any provider anywhere up on Perplexity and has a folder where it's all saved and he just keeps adding to it. And so now he can do what Fountain Life is doing. He can query his entire medical record and do trends and do cross comparisons and do cross tabulation and like has this sort of living record that he keeps adding to, right? And it's interesting, right? Because we cannot do that because Perplexity is not HIPAA compliant, ChatGPT is not HIPAA compliant. But if the patient makes that decision, they want to leverage the power of these tools, they can do this and they are, right? Another patient using ChatGPT, she uploaded all of her records to ChatGPT and is querying all this data and bringing it into me. And she's gotten to the point now, actually, she's like a really sweet woman in her late 60s, early 70s, severe chronic fatigue, lots of health issues, and then she's bringing me these outputs, right? But she's gotten to the point where she's interacting so much with this chatbot that she's given it a name, so Jerry. So she says, Jerry says this, what do you think, right? And I'm like, okay, well, let's look at this, right? And so yeah, there's a lot of things to unpack there, right? And so the personification of these chatbots and how we're interacting with them and how they take on this identity and we develop relationships with them, right? And there's a big discussion in the field for a number of reasons that we won't go into. But with this case, right, this patient now is this third entity, and Sunita, you talked about that in your talk, right? So there's a lot of power to that, right? So we have the patient, we have the clinician, we have the AI's chatbot, and on the one hand, that is something that we're all going to see, and it's cool, it's powerful, it's great. There's a lot of discussion to be had there, right? And on the other hand, there's a lot of potential pitfalls, right? On the one hand, Jerry was not always correct, not surprising, right? She was using ChatGPT. And so I got into the visit with her, looking at some of what Jerry says. Some of it was great. I was like, wow, this is really cool. Like, there's a lot of detailed information here. And it really dissected her health history and gave her a lot of actionable insights and very specific, like doses and timing and try this and try this. And she's going back and forth during her day with Jerry, right? But there were some things that were not right. And so I said to her, well, I'm gonna do a screen share. I'm gonna use my instance of ChatGPT. I'm gonna just cross-check some of these. And we're gonna call my ChatGPT Sam after Sam Altman. So we now have patient, Sanja, Jerry, and Sam in the right? And I was showing her that Sam did not agree with Jerry on a couple of things. All right, and so it's just a cool insight for her to see this that you can't always trust it. It is powerful. There's lots of good to this, but be careful, be aware of what we're doing. So. Side functionality that I really like, I use a note taker called Granola all the time. This is sort of like a non-medical note taker compared to like our scribes, like Heidi or Freed or Abridge or any of those other 84 companies that are around. But Granola is awesome. You can use this to take notes during meetings. It generates a live transcript. You can watch the transcript as the meeting is going. You can kind of refresh your brain. You can take those transcripts and put them into folders. So for example, when you're at a meeting or a conference or there's a recurring thing that you want to have all these notes in one bucket, you can add them to a single folder and then later query that entire folder, right? And so you can ask sort of trends across an event or a series of meetings or a conference, etc. So really, really powerful. You can also just do this with Notebook LM. You can take these transcripts, put it in Notebook LM, which is a Google instance, and then create this searchable your own personal LLM, large language model, of the content that you've generated. So really, really powerful, really, really simple. Really encourage everyone to use it. Granola's free right now. I think they'll probably switch over to a paid model soon. But where is this going in the EMR? You've seen Sunita, you've seen Vibrant present on some of this. You'll see a little bit more today. Obviously there's a lot of challenges right now, right? Siloed data, legacy platforms. we think about what's next, right? There's going to be this queryable, interactive EMR where all of the data, the AI, that's one of the most amazing things about it, is just makes all of the data come to life, right? Nothing is hidden. All those little nooks and crannies and corners, you can just get to it by asking questions and then iterating on that, right? And so Oracle is coming out with an AI, or has come out with an AI native EMR. There's a really great podcast on the Acquired podcast on Epic and their transition and how they're using AI. So this is the future, right? This is where things are going. And I'm very curious, I don't know if it's going to be really effectively possible to bootstrap AI on top of the legacy EMR systems because of how they've been built and how the databases are built. So I think it is going to really require, having this built from the ground up to be super effective. And major changes in the next, I would say, 1 to 3 years. Super fast moving right now. So, I predict that this is going to be this maybe 60 up to 80% of the clinical and admin work that in our practice will become doable, if not done, with AI over the next number of years, right? Availability, always on patient access, and then us as the clinicians are going to be this sort of spice on top, the humans on top, right? And I think it's AI for data and humans for care, right? I think that's my tech optimist side of this. And we're going to see this this augmented intelligence co-pilot model. The way I dream of this is that I'm in my EMR, it's scribing for me, it's capturing all those notes, there's a transcript that's running on the side, and up here on the upper right, I don't know why I put it there, but I did, upper right, there's this little chatbot that's sort of flagging things, it's identifying issues, it's saying opportunities, saying, hey, this lab hasn't been, A1C was high 6 months ago, hasn't repeated, you should order that again, or consider ordering that again. Or, hey, you just ordered this medicine, it interacts with this supplement, what do you want to do about that, right? So it's sort of kind of another set of eyes with this data and this AI model that can be on top of that, right? Eventually, yes, recommending treatments, suggesting, checking interactions, working sort of with you and beside you to, again, augment your capacity, right? And I think it's really going to be this seamless interface, and it's going to be this partner model. We talk about humans in the loop, but it really is going to be this more augmented, hybrid, interactive approach where the technology is going to be there with us, for us, right? But in a way that I think is very positive. As we get deeper into the panel, I think we'll talk about some of the pitfalls potentially, of which there are significant ones, but I appreciate your time, and thank you so much.
So good, Sanjay. We have some time here for questions, and there have been plenty of them. But before we get to that, Tom, you have been so intensely both curious and dedicated to your own kind of study and reading about AI and this field for almost 2 years. So can you just take a minute and talk about what you're excited about, and as we've moved through these 3 days with the 2 sessions and now the session today, what sort of comments might you have, and particularly suggestions for everyone that's really just getting started? And let's balance out. We've just seen enormous possibility and opportunities, and the other side of it are all the things around security and HIPAA compliance and hallucinations. But let's give you a chance. Let's hear from you a bit.
Well, first of all, I think the best advice that we've heard, and it's the simplest in terms of where to start, is what Sunita said, which is to sort of just start playing around. The tools that Sanjay just showed us are, if not free, very low cost, very easy to switch among, and so the opportunity to just give it a try. I was on a walk with Robert Luby a little while ago. And we were, and one of the things I know I've had to kind of struggle with, weirdly, is to remember that you can ask anything. So if you're confused about how to use the tool, you can ask the tool how to use it and confess your confusion, and the thing will somehow tell you, it'll get you started. It's really it's quite something. But I have to say, I have one question for our panel. I have a couple, but I want to now devote some of my time to a question I have for Helen, who does not know I'm about to ask this question. If you know Helen, and I've known Helen a really long time too, there's not a shred of intellectual laziness in this woman's body. If there is anyone out here who has invested more time, more money in the contents of her brain, I would struggle to find someone that's more invested than Helen. Now, what's interesting is we have run across an interesting phenomenon among some practitioners, which I would characterize as a cognitive bias, the sunk cost fallacy, which is to say, I've invested all this time in learning how to read this lab report and look for this pattern, and I am inclined to want to continue investing in doing it this way, despite the fact that there's now maybe a better way of going about it. And for some reason, I've never witnessed that. I'm curious to know, A, were you ever affected by this? B, now you're training new doctors, and I know you aren't training them to be intellectually lazy. So how has this been framed for you to be so exciting, so fast? You jumped into it. You were an expert before 2022 when we saw ChatGPT. What was it that caused you, as someone invested in your brain, to feel so comfortable augmenting it?
Wow, what a good question. Okay, great question, John. Thank you for the compliment. It's fascinating. Think of these tools as it's just a really powerful search engine, right? We've been using Google forever. We're so used to going in and finding that website. Now we have AI built into Google. So if you guys don't think you're using AI right now, you are. Every time you do a Google search, Gemini is answering for you. That's coming up. That's Google's AI. So I think this just makes you even more. Like, it gives you the entire sort of universe of information at your fingertips. I mean, it expands the need for a brain, because you have to, you use all of that, pull it together, and then it makes you even, wow, I didn't even think of that. Like, that's exciting. I think it makes clinicians way better. I think that, and you still need the clinician. Remember, we're still using the clinician to override things, to confirm things, that's really important. I didn't show you that the action plan too, it generates the action plan, but that has to be approved by the physician before the patient sees it. So I think, any question I have immediate access to the answers. And I think that just makes you a better and better clinician over time.
Thanks.
Yeah, it's a great question.
Yeah, Sanjay, let's hear from you, similarly.
Yeah, so I think those are all really important points. There's also a really, so this point around, asking for that information, getting the information back from a chatbot, and then what do you do with it? We're in this sort of in-between season of human in the loop, doctor in the loop, AI for data, doctor for care, et cetera. But there's also this really interesting phenomenon where actually the AI sometimes knows so much that it can give us such good information that you have to actually be cautious on how you receive that information and what information you either decide to accept or not. There was a study in October of 2024 that was in JAMA, and it used these standardized training cases that were used for fellows and residents, and there was 3 groups. One was the AI alone solves the case, the other group was the doctors alone solve the case, and the middle group was doctors using AI, right? So AI did really well, surprisingly well. It got 90% of the cases correct. The doctors alone got 74% of the cases correct. Doctors with AI, 76%. Right?
Yeah, that's amazing.
And what was happening was that they were getting this data from the AI, and they were like, I don't think that's right. I know this better. I've been doing this for 20 years. I'm really smart, and so there's this really interesting confluence that's going on of you gotta check the accuracy, you gotta make sure it's true, but you also have to be humble and understand that this data these systems are so powerful, and they're scouring so much data that our human brains cannot scour, and we're also, so it's a very interesting season.
Yeah, and it brings things up that you're gonna wanna dive deeper into, right? Does that make sense? Well, check that out. So to your point about the intellectual curiosity, I think it creates more of that, not less.
Yeah.
Yeah.
When we were talking yesterday, Sanjay, you were talking about how the more that clinicians rely on AI tools and the output, the more confident they get, which also can be a problem, right? So this theme of trust but verify, which Mike Ash talks about frequently, is hugely important.
Mm-hmm.
Yeah, I was thinking about that since our conversation and when we were prepping for this meeting also, because I think it actually goes both ways, where it can sort of pull up the lower knowledge, newer, not as experienced clinician, can really augment them and pull them up. But then there's also the situation where not all that information is coming from their brain. So they don't actually own that information. And so then if there's problems or side effects or issues, they might not know how to answer that right away. So then, on the other side, I think there's actually also a phenomenon where it might pull down the expert, right? Because these systems kind of regress towards the mean, and they're always trying to like find this middle ground. And so I think we've probably tried prompting these guys and these guys, these people, these amazing beings, these bots, these LLMs. And when you try to really drive it, sometimes it kind of hits a wall. It doesn't want to keep going, right? So it's very interesting.
And it's actually interesting that one of our physicians was commenting when they were using our AI, Zori, to present results to one of their patients. The patient actually felt a little bit ripped off. They're like, you're just reading what the AI says. Like, I could do that myself, right? I could just get but what they don't realize is that, the amount of collective knowledge that's gone into that, and that she's already gone in there and edited and trained it, edited it to say what it wanted to say. The patient's perception was, well, yeah, I can get that myself. Why am I paying for the doctor to do this? So I think that's really, it's gonna be really quite interesting.
Oh, I wanted to ask you both actually, because I think it's interesting how you described the workflow of pulling it into the conversation and actually showing it. And I talked to another doctor who I think I mentioned, actually had ChatGPT on in voice mode and was going back and forth with it with the patient there during their visit. And so, but I think your question, you mentioned this, this perception from patients, and so how do you, Sunja, kind of bring it up in your visits in a way that shows that you're actually elevating your practice by using AI?
Yeah, well, I think that any good practitioner, medicine is lifelong learning. We're always trying to learn. We're always trying to expand our brains, and if you're smart and humble, you know that the more you know, the more you don't know, right? And so I think patients really appreciate it when they know that we're looking stuff up, we're checking stuff. And I explain to them also, I think that like when I talk about my time at the podium, that when you're cross-comparing these things to the commercially available ones, to the medical grade ones, I think it's very eye-opening. It's a really good lesson for them. I think we all, we're using it up to date all the time, right? Quick show of hands, how many people have drastically lowered the amount we're using up to date right now? Yeah, so I think they really have to pull an AI in or they're going to go extinct with medicine. But I think people really appreciate it, and they appreciate that you're curious and that you admit you don't know everything.
Yeah, and I think, the one thing, it's not going to put us out of business. I always tell people, as long as the lawyers exist, we're going to exist. but I think that it really, how do you apply that? Here's all this information. Here's a really complex plan that AI's pulled together. You have to take that and apply that to the individual, right? Maybe they're not ready to do all of this stuff. That becomes the human interaction, right? What's important to you? What are you willing to do? How can we help you do that? Our coaches, our nutritionists use it a lot, but we still have coaches and nutritionists because you still need that human interaction and you still need to apply this information to that person.
Because it's not just about knowledge.
It's not just about
Pattern
knowledge.
recognition.
Exactly.
Pattern recognition piece is where our brains thrive.
I know we're running tight on time, but let's try to cover a couple other things. We recently fielded a survey of functional, integrative, and longevity medicine clinicians asking about AI use. And the top 3 uses of AI tools in the respondents was literature reviews, scribing, and care plan development. So what, other than those 3, just shout out, what would you most like to have? And then I'll tell you what people have responded with. What else would you like to see? What would you like to use? Okay, well, whoever said that, just, you can come on up now. But that's it, it's lab integration. And I know that I was just talking to Mike yesterday, and Functional Mind now has the ability to be able, with the new version, to be able to upload labs and interpret them. But why don't all of you just take a minute and talk about lab integration, because this is a really big deal for functional medicine providers.
Yeah, I'll just mention, we have built a system where you have those clinical workflows integrated right off the bat. So if you put an order in through Vibrant and it's connected to Quest Lab or a bunch of specialty labs, anything you get back gets incorporated into the chart and then immediately has lab interpretation. If that's what you choose to ask of the AI, you can ask it to help interpret the recent results that came through. In the totality of that patient's record, you can actually have it chart, and trend graphs for you in order to come up with the results that you might otherwise be doing in spreadsheets.
Exactly. The longitudinal trending of the labs, I think, is really, really valuable. You can see immediately it'll pull everything in and graph it over time. And then it can layer in. This is when they started their statin drug, or this is when they started their new diet or their exercise program. And so you can easily see it just puts that all together for you. But I also think lab interpretation is interesting. What does high homocysteine mean? You can ask it with high homocysteine, but then it'll answer not just that, but it'll pull in the context of a patient's other results, right? Well, this patient has low B12, right? Or this patient, homocysteine is high, despite the fact that their folate and B12 levels are normal. So we need to look a little deeper now. So I think, putting the answers of what the meaning of a lab is in context of the other data is really valuable.
Yeah, and on our side, we're still using a legacy EMR. We're using Servo, and so they have some degree of being able to trend labs, but it's really not perfect. It's kind of frustrating at times. So we take all those historical labs and we put them in just one section where we just keep a flow going of all those labs. But it's still kind of clunky. It's by date, long list by a year or two in. And so now we can take that entire set of data and put it into one of these models. And also for practitioners, Doximity has a HIPAA-compliant AI. Open evidence is HIPAA-compliant, so you can use those and really generate trends. Also, side note, we did check with our lawyers, so I'm not giving you guys permission if you want to check with yours, but they were fine on legal if we were doing screenshots of labs and using ChatGPT even to ask questions of those labs, as long as there was no PHI. Like you chop off the name, you chop off the date of birth, chop off the address, and it's just numbers and results. You can put that, according to our advice, what we got, into a non-HIPAA compliant chatbot and ask, and trend and ask questions of it. So one other unrelated but really important thing that I think we should all be thinking about is that this is on the maybe caution side. This takes a lot of energy on the AI side and a lot of water, right? And so how does that dovetail with regenerative farming and the health of the planet and the climate? And to cool these data centers and to run electricity that's running all these GPUs and processing is really a huge, huge thing. So some of the AI optimists say, oh, don't worry about it, AI is going to solve that, but that's kind of we'll see. But it's just something to think about, right?
And there's a lot of investment going into energy sources to power these, and renewable energy sources. There's some really innovative ideas out there to do that.
Terrific. I think we better close. I know that we're running into lunchtime. Huge thanks to all of you. And also the other folks this week, Lexi, Mike, Michelle. And we know this is a huge amount of information. There are tons of questions in the app that we'll have a chance to curate a little bit. And thanks for joining us.
Hey, thank you.